So I served for 14 years in the finest cavalry regiment in the British Army, which is the Queen's Royal Hussars. I was a Challenger 2 tank crewman, so I worked my way from driving and maintaining the vehicle to working the radio systems, loading the weapon systems and that sort of thing. We get given a set of rules to live by in the armed forces. And it's all about living to those rules. So if you're walking downtown, you're always sort of checking behind you, you're checking doorways, and it's something that comes natural to you, and you do it, you'll do it for the rest of your life. And these rules are things like selfless commitment, integrity. Everything is done regimented. You know, you've got your 3 meals a day cooked for you. If you want a GP's appointment, you can turn up on the morning and you'll be seen within an hour. Prescriptions are all free. You can, well, let's say you've got toothache, you can just go to the dentist and have the treatment done, and there's no bill to pay. And then all you have to do is get on with the job in hand, whether that be in Iraq or Afghanistan, or even if you're helping with the floods in Cumbria, for instance. You know, you just give 100% to your job and everything else is taken care of. I was told I couldn't serve anymore. And I was devastated, really, because I thought I was going to be serving for the rest of my 22 years. And to be told that, and then to be told that there's a resettlement process and that you're really employable because you've got all of these skills. I mean, I'm a Challenger 2 crewman, you know. I'm not going to be able to go and work in a supermarket with those qualifications. So it was a bit of a strange thing to happen. But, you know, I was quite positive, got my head around it, and ended up leaving on the set date. And I got a job in telecommunications. I lasted about 6 months and things went massively downhill. I tried to crash my van so that I could go home. And for whatever reason, I just wanted to go home. The job itself was fine, the people were fine. I thoroughly enjoyed the training aspect of it, but I think it may have been the loneliness of being on my own doing that job. I didn't do anything silly. I went home. I had a few months off on sick and then got this other job. I was victimised, I would say, in this job. I didn't like it, but it was paying my mortgage. And after a few weeks, I found myself on a 3rd floor ledge, just looking down, you know, and tears streaming down my eyes. Now, I don't know what brought me to stand on that ledge, and I don't know what I was going to do or if I was going to do anything at all. And this, it sort of transpired that I was depressed, anxious, and in the end it was diagnosed as adjustment disorder. And I think everybody that serves in the military and leaves at whatever point will go through that adjustment disorder, you know, severe or not. There's always going to be something there that sort of gets in the back of your mind that you're not quite good enough to do something. I was very fortunate that my wife again pushed me to go to the GP, and they referred me to a Let's Talk service. And I had a 10-week counselling sessions. I was on medication, and I also got the job that I've got now, helping people in need. Now, I'm a firm believer that everything happens for a reason, and maybe I went through this tough time to then go and help people in that same situation. But if I had somebody like myself looking out for me at that stage, then I think things may have been a bit easier. Going to talk to somebody about issues that could be related. Even to just have that, you know, somebody there that's done what you've done to say, you know, there is light at the end of the tunnel. There's no need to go and do anything silly, because, you know, things will go downhill, yeah, but it will always go back up, and there's always somebody there to listen, you know, go for a coffee with. And yeah, so it all worked for me, whether it was the talking, the medication. We got a cat at that time, and you know, I got the job that now I love my job. So those 4 things all sort of work together to make things, you know, so much better for me.
I was in the RAF, I was airframe and propulsion tech, also volunteered on the mountain rescue team for a while. I put my paperwork, it took me a year to get out, and then I left. The resettlement phase was quite good as far as I remember. I was trained as a fully qualified electrician. And I kind of had an understanding at that point of the first year or two that when I drank alcohol, I didn't perform as well as when I didn't drink alcohol, and because now I wasn't getting paid regardless of what I did month by month, I had to be at work to earn money. I just knocked the drinking on the head a little bit. And then after a little while of not drinking, I went back to drinking during a period of stress, and then things really sort of fell apart. Yeah, so I went through community services first. So in Herefordshire, that was DASH at the time through the NHS. I've got to say that that experience wasn't the best. I had somebody who was my key worker who I felt didn't really understand me, didn't understand what I was going through, didn't understand my particular problems with alcohol, and essentially just told me to stop drinking or reduce my drinking, and initially to stop drinking, and then try to get addicted to something else like exercise. I decided that this wasn't working for me, and I disengaged with that particular person. I was lucky enough at that point that my family were supportive enough to get hold of DASH again and insist that I was detoxed. And so I had a visit from the nurse. The nurse brought the medication. I was home detoxed in the summer of 2012. And I was sober for around 8 weeks. I didn't have any support after that from DASH. I was detoxed. I had a follow-up appointment to see how I was getting on a couple of weeks later, but I didn't have any key work after that. And I think that's probably because I didn't want it after my first experience of key work from that service. After 8 weeks, I threw my back out a little bit and had a little wander around town, decided to go to the pub. I was stressed because I needed to work, and went to the pub, had a coffee, then had a beer, and then I had a lot more beer. I woke up and I was in this same place that I'd left sort of 8 weeks before, where I was back into sort of full active addiction and unable to stop. What I thought was a 3-week bender was really more like a 3 or 4 month bender. And my family conducted an intervention essentially and asked me to go to rehab, at which point I looked at all the pain around the room and decided that if I was the instrument of that pain, then I needed to do something about it. So I agreed to go to rehab. I was rehab for 6 weeks, which was enough to get me started in recovery, but didn't really give me all the answers I needed. I needed to do something else. I needed to kind of work out how I was going to get well, but it was enough to give me a break and start to understand that actually there are things I can do to help myself. So.
We know some people are never going to want to access mainstream care. We equally know that some veterans, that is exactly what they want to do, and they don't identify anymore with being a veteran, a part of the armed forces, and would like something very different. What's really important is that we have a way of understanding that and signposting appropriately. Our approach within mainstream mental health, there are lots of services out there, funded services, third sector. We have the specialist TILs and complex treatment service. What's really important is we know what that range of services are, and that then we can really provide active support to people to access whichever one of those services is the right one.
So one of the things that is a real problem is the family unit as well with forces folk. That often the family take quite a hit, and there's very little support and indeed almost no research on what the impact is on them. And so if a family member of somebody in the armed forces or veteran comes forward and says there is a problem, again, it's really important to listen to them and what they have to say, because again, training will mean that the member of the armed forces won't do that to themselves. There's the stigma around appearing to not cope is great. And if there's somebody who's serving, the other thing is that people will be fearful of their career progression as well.
So I think from a practitioner point of view, we should be open to the fact that we're potentially dealing with a different culture. The difficulty is that most people in the British Forces and that have left the British Forces are white, British and male, and they sound like they're white, British and male. So it's very difficult to, at first glance, appreciate that somebody's got a completely different culture.
Very often when we're meeting veterans, armed forces personnel, they can be very articulate, highly functional people who don't wear the heart on the sleeve and will possibly minimise some of the difficulties they're having because it isn't part of who they are, and that can lead us to kind of minimise or maybe not see behind that well-functioning presentation when we're used to looking and talking with people, high-level vulnerability and difficulties in day-to-day living. It may not appear that way on the surface, so there may be something about just pausing and asking that extra question, just giving that extra space to saying, is there anything else? So that there's that opening for people to come forward if they want to.
Generally, we've got a couple of ways of dealing with anxiety or fear or things going loud. And one is we either move towards it and we fight it, or we move away from it, a tactical retreat, if you like. And so, in terms of treatment, that would look like somebody being aggressive, or it would look like somebody disengaging. I think it's really important that we remember that this is a human being sat in front of us, and we use our person-centered skills to elicit the information, try to understand that client from that client's point of view, understand their experiences, from their point of view of how they're experiencing it, to make sure that we are working as collaboratively with that client as we can, and making sure that we're empowering our clients, and the people that ask us for help.
The will is to try and help people, whatever they present with. We are always meeting people from different cultural backgrounds with different experiences to us, and I think there's something really important about not pretending that we do understand everybody's experience, but we're interested and we want to hear people's stories, and that will help us to help them.
We need to think about what we should be looking out for that is particular to those in the forces.
I think that everybody will have some sort of an issue of leaving. How complex that may be, who knows, but knowing that there's somebody there, it's a huge reassurance.